Good morning, friends. How are you feeling? How are you doing today? Give me a word, a phrase, a couple emojis in the comments. Let me know how you're feeling, how you're doing today. So, May is Lyme Disease Awareness Month. As you know, I've been yapping all about my story and just some facts that I think everybody should be aware of about the fastest growing vector-borne disease in the world, Lyme disease. So, today I'm going to be sharing just some frequently asked questions, answering some frequently asked questions that I get about Lyme disease. And if I don't cover your question here today, go ahead and leave it in the comments. And as always, feel free to message me, okay? So the number one question I'm asked is like, I was bitten by a tick. Does that mean I have Lyme disease? I don't know. It depends on so many variables, you guys. So, are you experiencing symptoms? Do you have a bullseye rash? Do you have a red mark that's just like spreading away from the bite? Are you experiencing flu-like symptoms, joint pain, achiness, all kinds of different symptoms that could be coming on from a bug bite? That's something to consider Lyme disease, right? So you can actually go to a website called tickcheck.com. And what I want you to do, if you do find a tick on yourself, definitely remove it properly and save that tick. Go to tickcheck.com. You can it helps you identify what species of tick that is, and it also has massive health information in there for us. So you can look up your specific county and look up the rates that the CDC is finding Lyme cases. So those numbers are varied and up for debate because the testing is so inaccurate. So on that tickcheck.com, just make sure that you read the little paragraph beneath your map of your county if you're going to look this up, okay? And then if you do have your tick, that if you found a tick on you, maybe it didn't even bite you, just still save it and you can send this in. There's lots of big data projects happening now where they're actually looking at the populations and testing these ticks for free for pathogens. So go ahead and look up tick testing, and if it did bite you, I highly recommend getting that tested by IGeneX for pathogens to determine if you should be starting treatment, because tick testing is so much more accurate than human testing. All right, and if you are in an endemic area, you can also go onto your county health website, and they should have specific information for your county. I know in New York they're showing 1 in 2 ticks are carrying Lyme disease. In Pennsylvania, it's like 1 in 3 ticks are testing positive for Lyme disease. So being aware of that and knowing, if you're bitten in New York, that you have a 1 in 2, 50-50 chance that you picked up Lyme disease with that bite, regardless of symptoms, because unfortunately our bodies don't always react to this bacteria, and you may be asymptomatic for years. So just be aware of your area and save those ticks for testing, okay? So number 2, what test can I do to rule out Lyme disease? As I mentioned a little bit before, the testing is super inaccurate. So the CDC states about 30 to 50% accuracy on these tests, and it's very inaccurate in the early stages of the disease when we really want to start treating, and it's inaccurate in the late stages because these tests, the Western blot blood test, is reliant on antibodies that are produced, in reaction to this bacteria. So there is a newer test called the PCR test, and that's like considered the gold standard test, where they are going to look at those samples for the bacteria of the DNA of the bacteria itself, rather than just looking for the body's response to the bacteria, if that makes sense. So I only know of 2 labs that do that right now. One is IGeneX and one is DNA Connections, and unfortunately these tests are so new that insurances will not cover it, and it's around $600 out of pocket. So and you're gonna have to find a Lyme specialist to treat you with that test. You're not going to be able to go through your insurance to find a provider to cover that test because it's not recognized by the CDC, if that makes sense. Okay, and then the other way that you can rule out or rule in Lyme disease is clinically through diagnosis. And if you check out the description of this video, I'm going to put a link to a symptom questionnaire by Dr. Richard Horowitz. I highly recommend just saving that on your computer, even if you're not thinking you have Lyme disease now. Just be aware of those symptoms and know what to look out for. So number 3 question I get all the time is, can you get rid of Lyme disease? This is debatable to say the least. So they say, you know, if you catch it early before it kind of disseminates throughout the body and gets into the central nervous system, that you can actually eradicate this bacteria. So the earlier you can treat this, the better off you're going to be. I've read all different kinds of variables on this, you know, anywhere between like 7 days and 14 days or 2 hours, and it's all over the place. There's not enough research to say like, okay, I got bit and then now I need to treat within X amount of time or else this is going to be disseminated through the body. I think there's so many different strains of Lyme bacteria. There's so many different variables inside the body, like what's going on with your immune system. So you could honestly, it could get right under your, and where are you bitten? If you're bitten like right on the central nervous system somewhere, could go right in there. Who knows? There's a lot of variables. So I'm gonna just read this quote here by the International Lyme and Associated Disease group here. So ILADS, they're called by short. So this quote is found on their website, and it's, many patients with early Lyme have been treated with short courses of antibiotics, less than 20 days, and recovered. However, both in practice and in scientific literature, it has been observed that a significant number of patients do not return to their pre-Lyme health with a short course of antibiotics. The ILADS Guidelines Working Group reviewed the available research and developed recommendations based upon the best available evidence, clinical expertise, and patient-centered values. So I've read anywhere between like 36% to 65% failure rate on those initial course of antibiotics. Then people are given a new diagnosis of post-treatment Lyme disease syndrome, and there's very little study done on this, and most people are still experiencing symptoms throughout their course of antibiotics. So the symptoms continue past those 20 days or whatever, and 28 days, and you are considered post-treatment Lyme disease syndrome now, and your treatment guidelines are totally different. So no, I guess, is like the short answer. Yes and no. If you catch it early, it's quite possible you could eradicate it. If you do not catch it early, you need to fight and get your immune system up and running so that you can get this bacteria in dormant mode and be considered in remission, and it's quite possible to be symptom-free of Lyme disease. So that is the answer to that one. Can you get Lyme, number 4, can you get Lyme disease in your town in America? Yes, it's been found every single state, every continent, besides Antarctica. And these ticks are spreading by migratory birds and dogs and humans. So, I mean, if a bird flies into your city park and drops off a tick that has Lyme disease, it has up to 5,000 babies that can survive a whole year without a blood meal. So now that city park has ticks, right? And so every time a Lyme positive tick has babies, all of those babies are going to be Lyme positive as well, creating some new endemic areas. It's spreading faster and faster with every mild winter. So these bugs are just having longer periods of time to reproduce, and it's really spreading so rapidly. And all right, number 5, if you think that you have Lyme disease, what do? I get this one all the time, mostly from people who believe they've had Lyme disease for a really long time, 20, 30 years of unexplained symptoms happening. You know, what do you do? I would highly recommend taking that symptom questionnaire, finding a doctor who's gone through the ILADS training, which you'll find a link in the description to the video as well on how to find that, and just reach out to your community, find people who have Lyme disease in your community and see what they're doing, see what doctors they're going to, and as always, reach out if you need support, okay? So that is my frequently asked questions on Lyme disease, and my name's Jen Hyla. I'm a speaker, a writer, and a wellness coach. And thanks so much for watching, okay? Until next time, be well.